This this is a case of 6 month male child in which the bilateral kidneys were diffusely enlarged and edematous with complete loss of corticomedullary differentiation. Kidneys were measuring around 8 or 9 centimeter in long axis and 4.5 centimeter in AP view. This case is a suspected case of renal vein thrombosis or acute pyelonephritis. The point in favor of renal vein thrombosis is that the patient is not having any tenderness in the loin region, no any laboratory findings of UTI or fever or any such complaint which is related to the pyelonephritis. So the cause of acute kidney injury I am suspecting is more likely due to renal vein thrombosis, and another finding is renal ischemia. This is the right renal artery which was showing little bit of high resistance. Normally it is 0.6, but it is 0.7. This video is very long and interesting, so those who have interest, they can see it full video. Here this right renal vein near right renal artery, the branches which are proximal branches which are just entering the hilum. Here the RI was 1.3, which is very high. Normally it is 0.6. Sorry, this is the artifact. The waveform seems normal. There is a technical error in the measurement. The RI is normal. Yes, this is the normal RI of that vessel, right renal artery, 0.6. This is the normal wave pattern. Second thing, this is the cortex, and if you see carefully, this is the cortex. There are this wedge-shaped hypoechoic area. This hyperechoic is the cortex, but the cortex is of altered mixed echogenicity, hyperechoic and hypoechoic, and these are very fine findings. You see this cortex here or here, it is showing hypoechoic some area over here, this and this. So this area and this area, so it could be due to ischemia, I think. Here also there is some hypoechoic area in the cortex, and the cortex has become thin. This is the cortex echogeny, and these are the renal pyramids which are edematous. These are the renal pyramids which are edematous and enlarged, and this is the renal medulla. This area is the renal medulla, and there is the loss of corticomedullary differentiation. We cannot differentiate the medulla and the cortex clearly. Second finding, these were some waveforms of the vein which I just kept for the record. This is the kidney, this is the medulla, this is the anterior cortex, this is the posterior cortex. See the texture. These were the waveforms which I had taken. I still have to work out what this kind of pattern means. right kidney, it was showing this kind of flow. uh, Somewhat the color flow was compromised. Just here only there was color flow and these areas were not, so I think it could be due to ischemia. These are the waveforms, and sometimes this renal artery, which main renal artery entering the hilum, it showed a very high peak velocity, maybe due to technical error or what, we don't know, but if you see subjectively, then this peak is very high as compared to the previous waves. As compared to the previous waves, let us see. Yes, these waves, they are a little bit short. These are the normal waves, and if you see these waves, they are quite tall. This, you see this tall waves with very high resistance, 0.8. And exactly I am not sure, but this is something like Parva stardust, a slow deceleration, long and slow. This deceleration time is little bit more. We are not supposed to come to the conclusion, but these findings, if we keep into the record, then maybe it can be helpful in future. This was the vascularity of the left kidney. This was the size of left kidney, 8.8. It is very enlarged, quite enlarged in 6 months of child. You see this loss of corticomedullary differentiation. And sometimes these vessels in the hilum, it showed very low peak velocity and low peak velocity and low resistance. Sometime when I used to keep this sample volume over here, then just nothing used to come like this. You see this, the sample volume is perfectly placed over here, but the waveforms, they are not visible. I did echo also, it was normal. And this right kidney over here, I am suspecting that this is the renal vein thrombosis, because it is not showing the color flow. Sometimes it used to show the color flow also. These are the tall waves, very high tall waves of left kidney, high resistance 0.8. Liver, although it was measuring around this 7.7 centimeter only in AP view, but this liver was little bit enlarged transversely like this. I had one X-ray, but it is not possible at present to show because the patient went. This is right kidney size 9.7, almost 10, for 4 centimeter. So you also just review and let us see what are the possibilities. Thank you.